Quick note. This is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. If you're searching for STD testing costs, you're probably weighing your options right now. STD testing is healthcare, and healthcare costs matter. Planned Parenthood handles over 2 million STD tests annually across the U.S., making it one of the most accessible providers for sexual health screening. The real question isn't just price, it's what you're actually paying for, how the process works, and whether your insurance covers it. Let's break down exactly what you need to know. Planned Parenthood offers comprehensive STD screening for chlamydia, gonorrhea, syphilis, HIV, hepatitis B, and trichomoniasis. Some locations also test for genital herpes and human papillomavirus, depending on the clinic. According to the CDC, testing is the only way to know your status, and many STDs have no symptoms. Planned Parenthood structures their testing in bundled packages rather than charging per individual test, which is important for your budget planning. Most people come in asking about the full screening panel rather than individual tests. Planned Parenthood uses a sliding fee scale based on household income and family size. Uninsured patients typically pay between $45 to $200 for a full STD screening panel, with most locations charging $60 to $150. This matters. The same test at an urgent care without insurance can run $200 to $400. Insured patients pay their standard copay or deductible, usually $0 to $50. The key is that Planned Parenthood clinics are independent nonprofits, so pricing varies slightly by location. Always check your specific clinic's current rates on their website before scheduling. If Planned Parenthood breaks out costs separately, chlamydia and gonorrhea urine tests run $20 to $40 each. HIV testing through rapid antibody tests is often $15 to $30 when purchased separately. Syphilis blood tests are typically $25 to $35. However, most clinics encourage the full bundle because buying tests individually costs more than the package rate. Medline Plus and the NIH recommend comprehensive screening for sexually active individuals, and bundled pricing makes this accessible. Many clinics don't even allow you to order just one test. They want you protected. If you have insurance, Planned Parenthood accepts most major plans: Medicaid, Medicare, Blue Cross, Aetna, United Health, and others. Under the Affordable Care Act, preventive STD screening is covered at no cost for eligible populations, meaning your copay can be $0. However, coverage depends on your specific plan and age. If you're over 25, you may have a copay. The Cleveland Clinic notes that coverage gaps often leave uninsured or underinsured patients with the full cost, which is why Planned Parenthood's sliding scale exists. Call ahead or check your insurance card to confirm your actual out-of-pocket cost. To order online, visit plannedparenthood.org or use their mobile app. You can search for your nearest clinic, check hours, and book an appointment directly. Some locations offer virtual visits for consultation, though physical tests require an in-person visit. The booking system shows available time slots and lets you choose whether you want a same-day appointment or to schedule weeks ahead. You'll need to create an account, enter your basic information, and select your preferred visit type. After booking, the clinic sends you intake forms to complete before your visit, saving time when you arrive. When you arrive, you'll complete paperwork about sexual history and any symptoms. A clinician will ask questions privately and confidentially. There's no judgment here. For most STD tests, you'll provide a urine sample or, if blood work is included, a small blood draw from your arm. The entire process takes 15 to 30 minutes. According to the NIH, Urine tests are now standard for chlamydia and gonorrhea because they're less invasive and just as accurate as older methods. Results typically come back within 3 to 7 days via a secure patient portal or phone call, depending on your clinic. Your STD test results are protected by HIPAA and state privacy laws. Planned Parenthood doesn't share your information with your parents, partner, employer, or anyone else without your consent, even if you're a minor, depending on your state. Results are locked behind a secure login portal, and the clinic communicates results privately by phone or encrypted message. Your insurance statement may show a visit charge, but typically won't detail the specific test. If you're worried about billing privacy, ask your clinic about paying out of pocket to avoid insurance reporting entirely, though the cost would be higher. If Planned Parenthood isn't accessible in your area, urgent care clinics typically charge $150 to $300 for STD screening, and your primary care doctor may offer testing for $100 to $200 after a visit fee. Community health centers often match Planned Parenthood's sliding scale pricing. Some pharmacies like CVS and Walgreens partner with telemedicine services that offer at-home STD test kits for $100 to $200, with results mailed or uploaded. The CDC recommends testing anywhere you feel comfortable. The goal is to get tested regularly, not to delay because of where you test. Planned Parenthood just happens to be among the most affordable options.